Hi, I'm State Representative Jon Hoadley, and we're going to talk today about patient safety in Michigan hospitals. During today's show, I'll be interviewing a local registered nurse about safe staffing in the hospital setting and its relationship to patient outcomes. After that, we're going to be hearing from a representative of the Michigan Nurses Association. It's a nursing advocacy group here in Michigan that's working to establish safer hospitals. So to start off, I want to extend a warm welcome to our first guest, Lori Batzloff, who's a registered full-time nurse here in Michigan since 2010. Lori, you've just had so much experience here working with long-term care, medical care, surgical care, and critical care. So I know that you have a lot of experience when it comes to patient care in Michigan. I'm also really excited that you're one of my constituents here in the 60th District. So I just want to start by saying thank you for being here and taking the time to talk to us today. But can you share with us, what are some of the challenges that you face as a registered nurse?
Sure, John, I'd be happy to. I really appreciate you having me here today. First, I'd like to tell you a little bit about why I became a registered nurse in order to better answer that question. I worked as a nurse's aide in a city hospital for about 13 years. I worked with really great nurses and I really loved my job. The best thing about my job was spending time at the bedside with my patients, getting to know them. And the nurses that I worked with, I think, saw that I was able to see the big picture with people. I was able to pick up on things that I thought maybe weren't quite right. And they encouraged me to continue my education and become a registered nurse, which I did, and graduated from nursing school in '09. And I've loved my job ever since. I love being a registered nurse. So the biggest barrier to my job is time. Having the time at the bedside to perform those assessments, to make those observations. As you know, there is no law in Michigan right now that would limit the number of patients that can be assigned to me during a shift. And that's very dangerous for the patient, and it has been shown to cause poor outcomes when the RN has more than an appropriate number of patients under his or her care.
Now, I know that we have a lot of really good hospitals in our region, but like you were saying, short staffing can cause a lot of problems. So just talk to me a little bit about what are some of the things that can happen when we have a short staffing situation in a hospital setting?
Yeah, sure, John. Nurses know from our own experience, and the research will back us up on this, that when nurses don't have the time at the bedside to assess a wound as often as it needs to be, or to change a dressing as often as it needs to be changed, or if nurses are so busy that medications are passed late, all these things can cause poor outcomes for patients. And as I said, the research does back us up on this. If you're a nurse on a med-surg unit, for every additional patient that you are assigned, the risk of death for one of your patients increases by 7%. Wow. For every additional patient that's added to your workload. And another research study I read shows that if you are a patient in the hospital and you have a heart attack on the night shift, you are more likely to die from that heart attack.
Wow.
Because in many cases, hospitals staff fewer RNs on the night shifts.
Wow. I mean, one thing that's striking me about these statistics is that these are repercussions that could reach anyone, right? Short staffing crosses all barriers, it doesn't discriminate, and so it's a question about resources and time. Now, do you hear similar stories from other registered nurses across the region or the state?
Yeah, absolutely, John. My colleagues and I hear stories all the time about unsafe staffing levels in Michigan hospitals and how RNs are stretched too thin or forced to work mandatory overtime. And RNs know that they need that time at the bedside to provide quality, safe patient care. So staffing is really one of the major concerns for RNs around Michigan.
But if we're talking about sort of time and we're a question of just making sure that we're spending enough time with each patient or not working that overtime, why don't nurses just say no?
Well, nurses are really put in an impossible situation when they're told that they need to stay. Nurses don't want to leave patients with inadequate care. They want their patients to be taken care of, and they want their coworkers to be taken care of. They want their coworkers to be able to do their job effectively. So, we're kind of guilted into it sometimes, and unfortunately, when nurses are able to stand up and say, hey, I'm feeling pretty fatigued. I don't think that it's very safe for me to stay.
Just too tired tonight.
Yeah, I just really can't. I just really feel like it would be a bad idea for me to stay another 4 hours. Unfortunately, there are managers out there that will bully them by reprimanding them. Nurses could be terminated. And unfortunately, some nurses have been wrongly told that if they don't stay, it would be patient abandonment and they could lose their license.
And we're not just talking, though, about regular shift hours. We're talking about overtime a lot of these times, where they're being asked to stay even longer than they're scheduled for.
That's correct, John. And fatigue is really a very serious issue. I don't know if you remember, this was many years ago. There was a study done comparing fatigue and fatigued driving to drunk driving. And shortly after this study came out, rules were put in place for truck drivers to keep everyone on the road safer. So, we need to recognize that nurses are professionals and they know how many hours they can handle, and we really need to be listening to the professionals about what kind of workload they're able to safely handle.
Now, previously you talked a little bit about your colleagues, and I know that moving to sort of team-based medicine and making sure that the patients are at the center of that team-based approach is becoming more common. So talk to me about why registered nurses are especially important when we're discussing the patient care and quality care.
Yeah, if you've ever been a patient in the hospital, or if you know someone who's been a patient in the hospital, you know that the person that spent the most time at their bedside was their registered nurse, and that really is where the registered nurse needs to be. The registered nurse is the part of the team who is constantly assessing, constantly observing, and needs to pick up on those small changes that really may be very significant and need to be reported to the physician and need to be dealt with in a timely manner in order to ensure the best outcome for your patient.
So are there some industry guidelines or some recommendations for how many nurses we should be having on a shift?
Yes, John, the Safe Patient Care Act lists ratios that are specific to each unit. So, for example, the ratios would be different, say, on a med-surg unit. An RN could have up to 4 patients under her care or his care. However, on an obstetrics unit, your patient condition changes as their stay goes on. So a person in early stages of labor, one RN may be able to have up to 3 patients. But certainly when a patient is in active labor, they need that registered nurse to be one-on-one with them. And then again, following a safe and successful birth where mother and baby are both doing well, one nurse may have 4 mother-baby couplets. And the ratios that are in this bill are based on evidence-based practice. They are based on research that shows when you staff at these numbers, patient outcomes improve. And if you go beyond these levels, patient outcomes are poor.
So you just referenced the Safe Patient Care Act. I'm really proud to sponsor that bill here in the legislature. Why don't you walk us through some of the main points of the Safe Patient Care Act?
Yeah, there's 3 main points that I'd like to hit. The first one is the ratios that are specific to each unit, and that those numbers are required. It's required that the hospital would staff registered nurses at that level at all times. So no matter the day of the week or the time of day, those levels need to be met in order to ensure good outcomes for our patients. The second thing that it does is it would ban that mandatory overtime, and except for in cases of emergency, which I think most people know healthcare workers and especially nurses are always willing to step up in the case of an emergency, and we understand that's part of the job. But we do not want mandatory overtime to continue to be used as a staffing solution. It really should be in cases of emergency. And the third thing that this bill does that is so important is it holds hospitals accountable to let the community know how many patients are assigned to their nurses. I have worked for facilities where I have been coached on how to avoid answering a direct question from a patient. Hey, how many patients do you have tonight? I have actually been encouraged by managers to not answer that question to avoid letting my patient know how many other patients are under my care for a shift. So those are three very important aspects of the bill.
Wow. Well, I'm really excited about these pieces. Now, we've been having these conversations in the legislature. I know that some folks have been saying, there isn't a lot of evidence that staffing impacts outcomes. I mean, what do you say to someone who makes that type of argument?
Well, unfortunately, that just doesn't make any sense, John. I would encourage someone who feels that way to speak to a registered nurse who works in a hospital setting and ask him or her, about a typical shift or about some stories they have or stories that their peers have. And as I've said, research backs us up on this. These are not just things that RNs have observed in practice, but there is a lot years of research out there that shows with higher levels of RN staff, you get better patient outcomes. And with lower levels of RN staff, you get poor patient outcomes, even including higher death rates among hospitalized patients.
Now, Lori, we're going to have to go in just a moment, but I did want to ask if you could leave the folks watching with one message about why the Safe Patient Care Act is important, what would you want to tell them?
Well, I would want to say, what do you want for your loved one when they're in the hospital? If you have an elderly family member who maybe is a little bit confused, I frequently have visitors want to stay with their loved one in the hospital to make sure that they're safe. You should feel that your loved one is safe no matter what hospital they're admitted to in the state of Michigan. Your constituents should be able to walk into any hospital in the state of Michigan and know that they're going to have an RN at the bedside that can provide quality, safe patient care. And the Safe Patient Care Act really goes a long way towards making that happen.
Lori, I want to say thank you so much for being with us here today. We're going to have to take a break in a moment, but I want you to stick around because after the break, we're going to be hearing from Dawn Kettinger, who is with the Michigan Nurses Association, who's going to be telling us a little bit more about their Safer Hospitals campaign. So stick around.
All of us want to make a difference. As veterans, we committed to protect our country. We served and sacrificed for the things that mattered most. Those experiences shaped our lives, even if it isn't always obvious to those around us. And now that we've served, our commitments have taken on a new meaning. We're husbands, wives, parents, friends, and neighbors, but sometimes we still feel alone. We forget that our biggest challenge can be to ask for support when we need it. The Veterans Crisis Line is here for all veterans, service members, and their loved ones. Dial 1-800-273-8255 and press 1. Chat online at veteranscrisisline.net or text 838-255. It matters.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
And I can't
She keeps me warm.
We are neighbors and best friends.
I love my sister.
My heart doesn't see race. Love is love.
Our family is no less than any other family.
Love is kind. Love is patient.
Welcome back. I'm really excited that we're going to be joined in the studio today with Dawn Kettinger from the Michigan Nurses Association. Thank you for being here, Dawn.
Thanks for having me, John.
So Dawn, tell us a little bit more about the Campaign for Safer Hospitals.
The Campaign for Safer Hospitals is a new initiative that brings together and mobilizes everyone who cares about making our hospitals safer. And it's led by the Michigan Nurses Association on behalf of all registered nurses. First and foremost, registered nurses are patient advocates, so this campaign is a natural extension of that.
Now, I know one of the main goals of the campaign is to improve the staffing levels in hospitals across Michigan, so everyone has a similar high-quality patient care experience. So what are the current staffing levels in Michigan hospitals?
Unfortunately, we don't know because hospitals are not required to disclose that information. Just as we don't have a law limiting the number of patients that a nurse can be assigned, we don't have any kind of disclosure laws where the public can know what staffing is like at hospitals. What we do know is that registered nurses from around the state consistently raise concerns and tell us that things that you heard from Lori in terms of not having enough time to spend with each patient, being forced to work too many hours, and how that translates into effects on patient care. So we really need to listen to registered nurses who are provide the majority of the healthcare in a hospital.
So we heard from Lori that she says we should set some ratios and set some guidelines here. So from your perspective, why do we need to set staffing ratios? And why do we have to require the hospitals to meet these guidelines?
Well, hospitals right now all make their own guidelines, and that's a problem because residents should be able to have safe, quality care no matter what hospital they go to. As far as ratios, what we've seen with staffing guidelines or staffing committees is that those just aren't effective. So the ratios, which are based on national research and a nurse's experience, are required so that every hospital is adhering to the standards to allow nurses to provide quality care and to keep their patients safe from harm.
And so when it comes to these ratios, then it's making it, requiring these ratios instead of making them optional.
Exactly. And, in many hospitals, they may not keep track of their ratios. They may have a very vague goal of ratios. But in terms of documenting the actual ratios, sharing that information, and meeting any standards, that's not happening in many hospitals.
So turning the conversation around just a little bit, we've heard a lot about a nurse staffing shortage. So like this nurse shortage coming up across the country. Are we going to be able to meet these ratios and the requirements in this law based on the current nursing environment?
Well, when we talk about having a strong registered nurse workforce in Michigan, there's a number of factors that go into that. First and foremost, we have to improve the working conditions in hospitals because we're driving our good RNs out of hospitals because they're being forced to take care of too many patients. So it's not enough just to graduate more RNs, which is a good thing we should be doing too, but until we stop this revolving door of burning out our nurses and them leaving either hospital care or leaving the profession altogether, we won't be able to ensure the quality nursing workforce that our patients and residents deserve.
So with some of these concerns, though, about in the workplace, wouldn't just a collective bargaining agreement take care of a lot of these concerns?
The short answer is no, and that's because even when there is a collective bargaining agreement, it's very rare for hospitals to agree to specific ratios. So then you have vague staffing guidelines or language, and it's very hard to enforce those, and nurses really have no recourse if the hospital doesn't take those recommendations. Also, more than 80% of registered nurses in Michigan don't belong to a union, so they don't even have a guaranteed voice in staffing. This is about making sure that every registered nurse, non-union and union alike, has the time and resources they need to provide quality care and keep their patients safe from harm.
Now, I know nurses show up in a lot of different medical settings. So talk to me a little bit about why does the Safe Patient Care Act only cover hospitals?
Yeah, there's no doubt that nurses can be stretched thin in all settings. Hospitals take care of the sickest and most medically vulnerable patients, so that's why we're making it a priority to improve the safety there. In fact, the third leading cause of death in America now is preventable deaths in hospitals. So, we really need to focus on that and make sure that we're addressing that issue first and foremost in the hospitals where we have life and death issues often.
Third leading cause of death. Wow. So this is obviously a problem that's not confined to Michigan. So what are other states doing to solve this problem or start trying to tackle it?
Yeah, there's a growing trend. A growing number of states are addressing this. 14 states have some kind of law that regulates the number of RNs working. Most of those have to do with staffing guidelines or establishing staffing committees, which is an approach that we haven't found to be effective. California was the first state to establish a law with actual specific numeric ratios per unit. And then Massachusetts recently enacted a law that in the ICU limits a nurse to having to take one patient, maybe two patients if the nurse feels that's safe. And then we have a number of states that have enacted some limitations on long hours or mandatory overtime, which, as you heard from Lori again, can really contribute to errors and complications and fatigued nurses who are not able to keep the level of care up that they want to.
So it sounds like there's a variety of responses across the country when dealing with the appropriate staffing levels. And that sounds like California's law is most like the law that we're proposing here in Michigan with the Safe Patient Care Act. What's the impact been on California?
Well, it's been a success in all three areas that are most important. First and foremost, registered nurses have the time to take care of their patients and provide quality care and protect their patients from harm. Secondly, California has become a magnet for registered nurses. Since the law, their number of licensed RNs has really exploded. So we're losing a lot of our best nurses to California because they know that if they go there, they can do the job they were trained to and they can keep their patients safe. And then thirdly, the hospital industry remains strong in California, which we want. We want hospitals to thrive. We just need to make sure we have a balance between making money and providing the best patient care.
So speaking of that balance, how would you tell or respond to someone who says the government shouldn't be telling a hospital how to run their business?
Yeah, government already regulates hospitals in a number of ways. And I think it's very appropriate for government to regulate institutions where public safety is affected, and that's certainly the case in hospitals.
So Dawn, I want to dig into this just a little bit deeper. I know that there's a lot of areas where government issues regulations. So talk to me about other industries and other similar regulations that we see related to these types of issues.
Sure. Well, in order to keep kids safe, we have a law that limits the number of children who are healthy per daycare provider. So we have that ratio. And yet we don't have a law that limits the number of sick kids that a nurse can be assigned. So that's one analogy. We also have limits on how long airplane pilots and truckers can drive, because recognizing that that's a public safety issue and that the longer folks work, the more impaired they are when it comes to doing their job, and that can have an effect on patient safety. So we see that in nursing, where nurses becoming fatigued. It's documented that they are more likely to make mistakes, not catch things that can get worse, not have time to properly educate patients and their families about what they need to do to go home. So there's certainly precedent in other industries for enacting this kind of law.
So the other piece that we hear a lot, of course, is how much is this going to cost? And, is this going to drive up the cost of patient care? So, can we afford to do this type of law and set these types of ratios and eliminating mandatory overtime and requiring more transparency?
Mm-hmm. Well, research suggests that over time, hospitals will be able to recoup any initial costs that they might have. And right now, they're losing a lot of money because of the staffing levels that they have. So they're losing money because Medicare is punishing them financially for preventable readmissions, which oftentimes can be avoided because if people get proper nursing care in the hospital, they're getting punished financially because they're having longer stays. Complications that are avoidable are lengthening the stays, and they don't get compensated for those extra days. And then they're losing a lot of money because it's expensive to recruit and train registered nurses. So all those things are ways that will even out over time in terms of the financial cost, if there is one, because some hospitals are better than others at, staffing. An interesting thing that happened from polling that was done last year, the first time this was ever done in Michigan, was that 71% of residents said, even if it costs more, we want this. We want this law passed.
I think we have some of these results so we can share.
Yeah, we do. So as you can see, overall, 80% of residents want this law passed, which is an astounding number. And we see that across all categories: Republicans and Democrats, geographical areas, age groups, men and women. There's widespread support for acknowledging this as a problem and fixing it. And again, 71% said even if it does cost more, we want it passed. And the other thing is that when people were asked, if your loved one was in a hospital in the past 2 years, did you feel that the nurse being assigned too many patients hurt your care? And nearly half of people who had been in the hospital in the past 2 years felt that the hospital assigning too many nurses had hurt their loved one's care. So people are aware that it's a problem and they want it fixed. The Safe Patient Care Act is a no-nonsense, common sense way that we can fix this.
So what I'm hearing is that even if it requires a few more folks to be hired in the short term, long term is it's going to save money, which is part of the reason, while it's improving patient outcomes and the quality health care people expect when they go to the hospital, it has such long-term savings and such high support across so many folks in Michigan.
Yeah, it has long-term support for enacting a minimum nurse standard, so that no matter what hospital you go to, it's not a crapshoot. If you go to a hospital in one area of Michigan that does their staffing well, you get good quality care and you're safe from harm. If you happen to go to another hospital in Michigan that doesn't do their staffing well, then you're more at risk. That's not fair. And we also, in addition to cost, we have to think about human lives. More than 1,000 patients die in hospitals every day. That's where the third leading cause of death comes from things that can be prevented in hospitals. And you can't prevent all of those all the time, but the research shows us that the ability of your registered nurse to spend proper time with you is the thing that has the most direct effect on outcomes.
Dawn, I just want to say thank you so much for coming in today. It sounds like the Safer Hospitals campaign is off to a great start. The state of Michigan is going to need to really tackle these issues if we want to build a Michigan that really treats all of our patients with the highest quality care no matter where you go.
Thanks for having me, John, and thanks for your support of patient safety.
So, I just want to start and say thank you again to all of my guests for joining us today and educating us about why the Safe Patient Care Act is important to patients and nurses alike. Now, if you want more information about the Act, I would encourage you to visit mysaferhospitals.org or feel free to contact our office. We're here to answer questions and get folks involved. So thank you for joining us, and we look forward to talking to you soon.